We've all had injuries before, whether something minor like a scrape or a bruise or sprained ankle, or things more serious. And we've seen that a little bit of ice or a little bit of heat can often help unless you choose the wrong one. So when should you use ice and when should you choose heat? By the end of this video, I'm hoping that you'll have a better idea of when to use ice, when to use heat, when to use neither, and maybe when to use both, so that you can make the right decision for yourself. Hey, my name is John Delk. I'm a physical therapist and chief operating officer here at EW Motion Therapy. I've been treating patients in the clinic since 1999, and I often incorporate ice and/or heat into my treatments. Today, we're going to talk about how to decide which one to use based on what's going on with you. So let's talk about what icing does. Icing, also called cryotherapy, is very beneficial for acute inflammation. Acute inflammation can be due to an injury, such as a sprained ankle, or a muscle strain, or it can also be due to surgery like a rotator cuff repair or a knee scope. Icing will help with acute pain because it acts as a temporary numbing agent. It also restricts blood flow or constricts the blood vessels, which will reduce inflammation and swelling. Sometimes after a strenuous activity, athletes will use ice baths or ice packs after practice or a game because it really helps bring down the inflammation from that. Let's talk about how ice can be applied. In the clinic, we often use gel packs, which are great because they're very malleable and bendable and they can kind of conform to a body part. You can actually make a homemade ice pack using 2 parts water and 1 part rubbing alcohol in a Ziploc bag. Good old crushed ice, pellet ice in a bag is great. Frozen vegetables, frozen peas and corn, things like that will also conform to a body part are really good. For a small area, like an elbow or a heel, we'll use something called an ice massage, which is a little Dixie cup, a paper cup, fill it with water, put it in the freezer, rip the top of it off, and you've got a nice little meniscus of ice that you can rub on that body part. Let's talk about what heating does. Heating or thermotherapy has the opposite effect on blood flow. Heating dilates the vessels, which helps bring oxygen and nutrients into the tissues, and it can actually help bring waste out of the tissues as well. That increased blood flow has a relaxing effect on chronically tight and stiff muscles. You can also use heat before activity. If you use heat with movement, it can be a great warm-up for muscles and joints. Now let's talk about how to apply heat. Hot water, such as a hot shower or bath, is a great way to do it. There are several versions of heat packs out there: moist heat packs, dry heat packs, the plug-in heat packs. What we use in the clinic are called hydroculator heat packs, and they are cloth packs with a clay-filled substance, and they get extremely hot. So we wrap them in towels and heat pack covers and apply them to the skin that way. Just remember, if you're going to use heat, always consider using layers because the risk of burning is there. Now let's talk about when to use both. There's a concept called contrast therapy or contrast bath. We're using alternating ice and heat for specific durations of time. That really dilates and constricts the vessels, which moves nutrients in and out, moves waste in and out, and it's great for inflammation and swelling. The other concept is not at the same time, but after surgery or after an injury, you will use ice during the acute phase, in the initial phase of recovery, and then heat later on in the later stages of recovery. There are certain times when you wouldn't want to use ice or heat necessarily. Certain medical conditions where you may have a hypersensitivity to heat or cold, or a nerve damage where you may not feel the heat or cold, there's a risk to damaging your skin. Also, if you ever have an open wound, you probably don't want to use ice or heat on that. Now you know more about the benefits of ice and heat and how you can use them. But for an injury, they should not be the only treatment that you pursue. Click the link in our description below to watch our video, What is Physical Therapy? This video goes into more detail about what physical therapy can offer.
If you found this video helpful, be sure to give it a thumbs up and don't forget to subscribe to our YouTube channel to help you on your physical therapy and wellness journey.